Hi, Cindy Turner here, creator of Evolving Women. And today I'm super excited to have Dr. Emilia Dauway with me. She is a phenomenal woman doing incredible things in the world around breast cancer, and I'm so excited to have her here to have a conversation with me today. But before we dive in, I'd like to share a little bit about her background. Dr. Emilia Dauway is the former Chief of Breast Surgery and the Director of the Breast Cancer Program at Baylor Scott & White Healthcare in Texas. She's an American-trained surgeon who has taken the opportunity to come to Australia and practice here. So we're very, very fortunate to have her here on our shores. And also recently of note, she won the Inspirational Woman of the Year award this year in 2019 for her holistic work in treating breast cancer through yoga and mindfulness practices as well. So welcome, Emilia. So glad to have you here today.
I'm glad to be here. I'm very excited to have the conversation.
Excellent. Well, thank you so much for joining us. I'd love to know a little bit about the way that you're working with women at the moment, because what I was so fascinated to find when I met you was how you bring yoga and mindfulness together in the way that you treat with your surgery. Tell us a bit more about that.
Yeah, so I know it sounds kind of strange for me to be a yoga instructor and a surgeon and blend the two together, but actually it just happened organically, in the sense that I have my own yoga and mindfulness practice. So I don't consider myself just an instructor, but a practitioner. So I don't offer my patients anything that I wouldn't do myself. And I found a lot of physical and mental benefits from yoga practice, it helped me to be a better surgeon, calmer, less reactionary, more responsive. And also it's helped me to understand physiologically how we're impacting women, particularly with breast reconstruction. So from my own personal practice, I said, I really find so much benefit. This is something that I would love to offer my patients some kind of way. So I did my yoga teacher training, and then I also went on to do mindfulness training, because I actually love the philosophy of yoga and all the limbs of yoga, which I teach my patients, and the power of the breath and what it can do to support people mentally and physically. So I found a way to incorporate that and dribble it in a little bit, sometimes very carefully and subtly, to help my patients during treatment, as well as especially after treatment's completed.
So I believe you've been a breast surgeon now for roughly 20 years.
Yes.
When did you introduce the more sort of Eastern ways into your practice?
It was a patient of mine. So I follow my patients for 5 years. So I have surveillance to look to make sure that the cancer doesn't return. And if it does, that we identify it early on where it's still treatable and curable. But my patients are my greatest teachers. So over the 5 years, I learned from them some of the things that they deal with psychologically with the impact of treatment. And there was a patient at the time of her diagnosis. She had what we call ductal carcinoma in situ, which is stage 0, early curable cancer. And she was very emotional about the diagnosis and was crying. And I said, why are you crying? And she said, well, I'm afraid. And of course you're afraid when you have the diagnosis of cancer. And I had been doing this for so many years. And I thought to myself, well, that's odd to be afraid. She was afraid of dying. And I knew I was going to cure her. And I don't usually guarantee a cure, but I said, that's kind of odd to be afraid of dying, because we're all going to die one day. Like, I'm going to die. We're all going to die. You're going to die.
One-way
and
ticket.
It's a one, like, we're here to have this. I feel like we're spiritual beings having a physical experience. And so if we're afraid of something that's inevitable, sometimes that holds us back from living fully and wholeheartedly. And I don't want my patients to live with that fear forever and ever. And so she kind of I had this aha moment because of her. And she's also the same patient that after her treatment was completed, she had to have other treatment like radiation. She felt that a door had been shut. Even though I kept following her, she said, it feels like a door has been shut, and I didn't have the support I had during treatment. So those types of comments and those types of things that patients, the feedback that they give me, really helped me to become a better surgeon, to look at them as a whole person and to understand what's happening with them not just physiologically, but also psychologically.
So since you've introduced yoga and mindfulness into the way that you treat your patients, what changes have you noticed in the way that they're recovering or how they're coping through the treatment and beyond?
So I do have a 8-week mindfulness restorative yoga program for patients after they've completed treatment. And it's funny because during the mindfulness part of it, some of my patients will say, "Oh, Emilia, this is like a forever thing." And I said, like you have to practice this forever. Like it's not like when the 8 weeks finishes and now you're like going to be Zen forever and there's never going to be any struggle or challenges. It's really to use the work of Dr. John Kabat-Zinn, who introduced mindfulness in the 1970s into American medicine and into medical schools and universities, where we start to use the pillars of mindfulness, patience and non-judgment and those aspects, and we cultivate a mindset to support ourselves in times of challenge and struggle. And we're all going to have physical challenges, illness. We all have probably experienced the flu at some point in time, but we don't define the rest of our lives by being a flu survivor. So if we put it into that context and think about it, it's kind of like, oh yeah, I don't have to be defined by an event, divorce, or financial struggles, or things like that. They're experiences, and can we sit in that experience and just have it as an experience and learn something and then move forward from the lessons that we learn? Or are we going to allow it to define us and we're going to sit there forever? So you can actually use one of the pillars of mindfulness, which is letting go and acceptance, accepting that, yes, the experience happened, and can we let go of it and just have a neutral mindset to it and go forward.
I love that. That's beautiful. So having been through breast cancer myself, I know that this is a topic very near and dear to my heart. 4 years ago, discovered that I had breast cancer with a surgeon who was very clinical, very cold and very matter-of-fact about, gosh, you've got this and I can book you in for surgery next week. And I'm like, I was so confronted by the news of having it in the first place. I was quite dismissive of like, oh, I'll be fine, it'll be fine. And so in that moment, it was like I was just struck with, this is something that's so far beyond my control. I was so caught up with fear and anxiety about what if, you're in that sort of what if space of like, oh my gosh, I don't know what's going to become of this. You must be challenged by these conversations regularly in your practice.
Well, breast cancer is quite common in the sense that it's a mainstream illness that people are aware of, whether they've experienced it personally. Most people know someone who's experienced breast cancer, a colleague, a coworker, a family member, a friend. But when you are diagnosed with it yourself, and it is something that's out there that people are aware of, there's a bit of shock, like this doesn't happen to me, this happens to other people. And to be quite honest, no one has time for breast cancer. No one has time to, we become humans doing as opposed to humans being. So we've got, a lot of women, we have careers, we have partners, you're running a household, you have children, maybe even aging parents. So you have a lot of different hats that you're wearing and a lot of things going on. So who has time to throw that on your plate of responsibilities? So it can be quite shocking, overwhelming. And then, of course, even if you tell them, yes, this is something very treatable, in the back of a person's mind is still that fear of death, and then the unknown of how you're going to have the side effects of treatments. And so there's all of this emotion and things that are tied up in it. And I think that, yes, women don't have control over the diagnosis that they actually have breast cancer, but they do have control over how they choose to respond to it. And that's giving them power back and allowing them to make some choices, because you have options. And so that's one of the things my nonprofit Restore More, we have a campaign to educate women about what those options are, whether they have breast cancer or not, just so that they know that breast cancer in this day and age, most women who are getting treated, most women that are going through screening programs, which we have screening in the US and in the Australia and Western countries, that they'll have the choice between keeping their breast and having their breast removed. Interestingly, because I've moved to Australia and I work regionally, I've learned that regional women in Australia are more likely to only be offered a mastectomy and less likely to even be offered reconstructive surgery, which is how Restore More was born, out of that frustration of making sure that women were empowered and could take a moment to just be still with the diagnosis and then make a choice that they can live with. So empowering them with choice.
I absolutely love that about your approach, is that it's about empowering the woman to help them make the best choice for them.
Because as physicians, we don't, as medical oncologists, surgeons, we don't live with the consequences of the choice. The patient does. Yeah.
So what should women be aware of or be looking for in their breasts to have awareness that they may be developing breast cancer?
Well, I believe at the age of 20, you should start learning to do self-breast exams. So making sure that there's symmetry in the breast. I always joke with my patients, your breasts are cousins. They're not identical twins. They are, sometimes one's a little bigger than the other. The nipples don't sit quite the same height. And as you age, you know, those things kind of start to go down because of gravity. So you need to be aware of any changes that occur in the breast. And if you're still menstruating, then the best time to examine your breast are a week after you complete your menstrual cycle, because there's hormonal changes that happen. And so you may feel something at one point in the month that you wouldn't feel at another time. If you're postmenopausal, I just say pick a day of the month. There's probably an app for it at this point in time. There's apps for everything. And you can you examine yourself looking for any lumps, looking to see if there's any discharge. Some women can actually express discharge from the nipples, but if it's coming out on one side on its own, that's not considered normal. If the nipple starts to sink in, that sometimes is normal for some women, but if it's new, then it's something just to be investigated. I say better safe than sorry. Go to your GP and get it tested. And then once you reach a certain age, the age of 40 or 50, depending on where you are in the world, we recommend starting your screening mammograms. And then also considering risk factors such as family history and other risk factors, you may start your screening at an earlier age using mammography.
So really good advice would be for women to tune into their bodies and what their body may be telling them.
Absolutely, because that's good just in general.
And I think that for me was how I picked it up. It was a sensation, it was a heat that I was feeling, and so I went off to get a mammogram, just thinking, oh, I'll do the right thing and get the screening, and that was how it was picked up for me. Yeah,
and the thing is, if we can detect it early, I mean, by ignoring something, it doesn't make the problem go away. Some women don't want to get mammograms or get screened because they don't want to know. They don't want to find, and they say, well, I won't get this treated. Well, the problem just gets worse and festers until it gets to the point where it's, not just difficult to treat, but it becomes a nuisance for the woman. And I've seen educated women that are knowledgeable and know about mammography, and they come in with advanced breast cancers that are extremely difficult to treat, and it then starts to limit the options. And I think if a woman has options, it's much better, because she has control over how she wants to respond to it.
So if a woman watching this today has just discovered that she's got breast cancer, what treatments are available? How could you empower her if she might not have?
There are so many treatments. There is surgery, chemotherapy, radiation, which are the main three that people are aware of, but there's also hormonal endocrine therapy, not hormone replacement therapy. If you're not in menopause, it puts you into menopause. Hormonal endocrine therapy, and there's biologic therapies, and there's immunotherapy. So there's many treatments. The cornerstone is still surgery, but even if a woman comes in and the lump is quite large, if we know she's going to get chemotherapy anyway or possibly need it, we can actually use what we call neoadjuvant or induction chemotherapy, where we shrink the tumor, and then the patient may be able to keep her breast. Sometimes we use something called oncoplastic surgery, where a woman comes in and, the breasts are a little bit droopy. She's breastfed maybe, and maybe over time with aging, we can do a lumpectomy or remove the cancer with a margin of normal breast tissue, and we can reposition the nipple back to where it was when she was 16. And of course, I always joke around that the other breast is jealous that it didn't get breast cancer. So of course, we have to do the other side for symmetry, and that's actually covered by Health Fund and Medicare. So there's so many different surgical options. And even if a woman requires or chooses to have mastectomy, there's different types of mastectomies. We keep the nipple sometimes, and can do immediate reconstruction. There's implant-based reconstruction, autologous reconstruction using your own tissue to reconstruct the breast, and there's advantages and disadvantages to both. So there's so many options, as you can cell. And yeah, so our number one goal obviously is to cure the woman and to get rid of the cancer so it's not a problem in the future. But the other goal is to make sure that we maintain function. And that's, as a yoga teacher, I've learned the physiology of different poses, and there's certain reconstructions that I would probably, in my previous years of practicing, I would say that was a good reconstruction. And now it's a reconstruction I would use as a last resort because it creates a lot of dysfunction. And I've learned that. We have a kookaburra that's visiting and learning about breast cancer in the tree. How beautiful.
They're friendly.
Yeah, I love kookaburras. Yeah, so there's different things that we need to consider before we just operate on patients, because we want to maintain function. We want to give them the best aesthetic results as well, so there's not that constant disfigurement and reminder of their breast cancer, because we want them to move on to live a wholehearted, full life through mindful living.
So any woman confronted with this challenge at the moment really should be encouraged to get curious, to understand fully what her options are,
and to ask questions. And if you feel like you're being rushed, so breast cancer doesn't get there overnight, so we don't need to cut it out overnight. We don't need to go. And I actually, if a patient is overwhelmed, if one of my patients really I can tell is, I've given them all this information because I educate them about lots of options. So that's a lot of information that's overwhelming. And they don't know what they're going to do or want to do. Then I say, okay, you're going to come back in 2 weeks. And they feel, sometimes they just want it cut out. So I said, no, we're going to back away from the edge of the cliff. You're going to take a deep breath, and you're going to go and you're going to talk about this with your partner or your family, and take some time for yourself. It's not going to spread. I would never compromise someone's potential for cure and survival by waiting. And then they can come back, they can book, and they can get a date for surgery if that makes them feel better. But I want them to stay calm, because what most women don't realize is that a lumpectomy, keeping your breast, has the same survival as a mastectomy.
Right. Wow.
Stage for stage. So if I tell you, if you came to me, you had a cancer on your leg, and I said, I can cut that cancer out and give you a little radiation there, or I can cut your leg off and I can give you a prosthetic or not, and you can possibly win a Paralympics. Or you have two legs, so why don't we cut off both legs? Because you might get it in the other side later. Would you choose to have your leg cut off? And most would say no. Most would not want their leg. They would want you just to remove the tumor, get a little radiation, move on with their life. Our breasts are the same. Exactly. So if a surgeon offers you a lumpectomy and we can get clear margins, and it's safe to do, and you're willing to go through a brief period of radiation, which is just a local treatment to the breast, then you're going to live just as long as someone who's had more radical surgery. So it's really making sure that patients are informed, and they're making decisions from a position of information and making an informed decision instead of a fear-based decision, because most women don't know what it's like to not have their breast. And we can't go back and put it on. We can do reconstruction, which is not the same as having your breast. It's a great option for those that have to have their breast removed or choose to, and they're okay with that. But most women will not know physically what it's like in their body to have a breast that they've had their whole life. It is an amputation of a body part.
Absolutely. So I'm super excited to be having your Serenity program on the Evolving Women platform. So tell us a little bit about the Serenity program and what is included with that. What will women learn?
Yeah, so Serenity is a program that I'm developed. It's a yoga mindfulness-based program for women at the time of breast cancer diagnosis, so that they can learn to use the principles of yoga and mindfulness to support them during treatment. So if you're going through chemotherapy or some of the other treatments that can create nausea, there's actually ways you can use your breath and even yoga poses that reduce nausea or the anxiety around the diagnosis, and just some of the anxiety that's around the unknown. Even with surgery, going into surgery, we've helped patients using their breath, and my anesthetist will point out, that patient was really easy to put to sleep. And sometimes my patients will say, well, Dr. Emilia, I'm just going to be with the experience. And I'm like, good. We're just going to be with the experience. We're going to use your breath and breathe through this. We're going to get you to sleep, and before you know it, you're going to be awake and fine. But breath work and yoga can also help with pain management. There's breath work that helps with lymphatic drainage. And just by calming the mind and using even meditation techniques, I know that you had met Sorensen on, and you put on Evolving Women the meditation and even some of her breath work, which is amazing. Yeah. That helps to actually create physiologic changes in the brain. So Serenity is not just about learning the breath work and the yoga, but you're going to learn the science behind why meditation works, what it does to the brain, so that you're educated about these principles as well. So it isn't a lot of woo-woo things. It actually has some scientific basis as well. Absolutely.
So it's a 6-week program, and it helps a woman navigate through the first 6 weeks of discovering she has breast cancer and working through treatment.
Yes, and there's tools that you will be that will empower you to not just use during the 6 weeks or just during treatment, but afterwards. So it creates, it helps you to cultivate a mindset so that you can live mindfully for the rest of your life. So it's actually something that not only breast cancer patients, we all could use a little bit of mindfulness and lifelong tools to use our breath work to help us in our challenges that we encounter in this life that's just part of being human.
I certainly wish that I had the Serenity program when I was going through, because it was certainly a very challenging time in my life. So they would be great tools for
I liken it to a hurricane. So we sometimes have hurricanes in our lives, but if you know what a hurricane or cyclone in the southern hemisphere it's called, in the center of the hurricane, a true hurricane, there's something called the eye of the hurricane, or the eye of the storm, and it's an area that's beautiful, calm, and peaceful and serene, which is why it's the Serenity program. Yes. And can you, during the time of diagnosis of cancer, which can be a very significant challenge in your life, can you find that eye? Can you find that center, that calm, the area of serenity? And it's something that exists and we can all access, and it's inside of ourselves. So it's building those tools to find that area of serenity that you can always go to, that's always been there from your beginning, and use that to find calm when you're going through struggle in life.
Love it. That's beautiful. So one of the other amazing things that you're doing on top of your everyday work is you've started a not-for-profit called Restore More, which takes you internationally to do mission work, and you've just come back from Nepal. Can you tell us a little bit about this work?
So Restore More actually was born from some of my frustration of being able to provide regional women who are in geographically challenged areas in Australia to have the same opportunities as women in metropolitan areas in terms of their breast cancer treatment options. So Restore More, actually we use yoga and mindfulness workshops to fundraise to get women financial support to get breast reconstruction, because as I mentioned earlier in our discussion, that regional women are more likely to only be offered a mastectomy and less likely to be offered breast reconstruction. So if you can imagine a woman who years ago had a mastectomy, did not realize she could have breast reconstruction that was covered by Medicare and Health Fund, is less likely to be put on the public waiting list at this point if she's 10 years out, because they're treating patients that have active cancer. And if she doesn't have private health fund, it can be quite costly. So we help to provide financial support to provide access to that level of service. But we also, Restore More has a campaign called A Woman's Right to Choose that is now also trying to help women to understand what their options are so they can feel empowered to even choose to keep their breast and not have the fear of keeping that body part, and that they're going to still live fine. They're still going to survive their cancer. We also have an international outreach that we started in Nepal, which is Dhulakal Hospital, which is a town of only 10,000 people, but they have a 400-bed hospital where people from all over Nepal will come. The hospital itself is a non-for-profit hospital. And in Nepal, they don't have any breast screening programs. And women there are more likely to be diagnosed at a younger age, and their risk factors for women in Nepal are very different than Western women. So we're helping to provide awareness and education to their regional women. So interestingly, Nepal has the same population size as Australia, but land-wise, they're significantly smaller. But like Australia, they have challenges sometimes to get health care out to more regional areas because of their terrain. If you've ever been to the Himalayas, the mountains and so forth are very can be very dangerous in the roads and difficult to get through. So we went and we are working with Dulakal Hospital to create a screening program to educate women how can we get services to regional areas of Nepal. Also, we donated $15,000 of breast prosthetics because women there are diagnosed at more advanced stages of breast cancer, so they're more likely to have a mastectomy, and to make sure that they have prosthetics and mastectomy bras. So we partnered with the Breast Cancer Care Network, the nurses. They helped to get bras, and Amina, the prosthetic company, helped to donate really nice prosthetics and bras. It's kind of funny because I had bras and some of my patients were like, those are really beautiful bras. I don't know those bras existed. And I said, they're for the women in Nepal. You can have them. So it's quite, hey, you want to come over here? Do you see this? Look at them.
Oh, very friendly.
Yeah.
So if a woman was interested to know more about Restore More or get involved with your charity, how might they do that?
So Restore More has a website, restoremore.com, which will soon be restoremore.org. And so we have a website, and we do have a Facebook page. And on the Facebook page, you'll see all of the different regional presentations, our Women's Right to Choose campaign, different regional cities and towns that we'll be in. And also we do yoga and mindfulness workshops in different yoga studios around Queensland. We're hoping to do one in November on the Sunshine Coast at NRG Yoga Studio. Yeah, so you can check it out on Facebook as well as our Restore More website. If you want to get involved as a volunteer, you're more than welcome. We're hoping to do a yoga retreat in Nepal, so women can go there. It'll be a fundraising retreat for women to go there, experience whether they have breast cancer or not, to experience the beautiful country of Nepal, the yoga there, and then if they want to do some volunteer work, we can incorporate some of that as well.
Fabulous. Thank you so much for your time today, Dr. Emilia Dauway.
Thank you. Thanks for having me. I really appreciate it.